If you're over 60 and you've started waking up without an erection, don't brush it off. That's not just age. That's your body giving you a warning sign. And the men who listen, they often catch something early, something fixable. The ones who ignore it, they often end up losing more than just performance. Confidence fades, intimacy suffers, and in many cases, heart health is already in decline before anyone notices. I'm not here to scare you. I'm here to tell you that there's something you can do about it, starting today. I'm Dr. Sophia Jain. I'm a board-certified urologist specializing in men's health for over 20 years. I've helped thousands of men in their 60s, 70s, and even 80s restore natural function without relying on pills, injections, or surgery. And I'm here to share with you 4 powerful exercises that work. Not gimmicks, not trends. These are science-backed physical methods that target the real root causes of erectile decline: blood flow, muscle integrity, and nervous system balance. What I want you to know right away is this. Erections are not controlled by your genitals. They're controlled by systems: muscular, vascular, and neurological. And the good news? You can train those systems. You can stimulate recovery. You can absolutely rebuild performance. But you need the right approach. Let's start with the first exercise, and it's the foundation of everything: deep pelvic floor engagement. This is not the same thing as a Kegel. Most men have heard the word, but few are doing it correctly, and even fewer are using it strategically to restore sexual health. Here's how I explain it to my patients. Think of your erection like a hydraulic system. Blood flows in, pressure builds, and the valves, the muscles around the base, lock everything in place. When those muscles are weak, the blood leaks out faster than it comes in. That leads to short, soft, or inconsistent erections. When those muscles are strong and coordinated, they grip the base like a clamp. They hold the blood in the chambers, they support the shaft, and they give you that strong, lasting function. Now, how do we train those muscles the right way? Step 1, awareness. Sit comfortably or lie on your back with knees slightly bent. Take a moment and breathe normally. Then pretend you're stopping the flow of urine midstream. That little lift you feel, that's your pelvic floor contracting. It's deep, subtle, and internal. You should feel no movement in your abdomen, thighs, or buttocks. Place one hand on your stomach and one on your inner thigh. If either hand moves, reset and focus again. Now the exercise. Contract that pelvic floor gently and hold for 5 seconds. Breathe normally as you do it. Then relax completely for 5 seconds. That's 1 rep. Start with 10 reps, twice a day, morning and evening. After a week, increase the hold to 7 seconds, then 10. Your goal is full engagement with full relaxation after each one. This is not about squeezing as hard as possible. It's about control, endurance, precision. After 3 to 4 weeks, you'll notice changes: stronger morning wood, better control during intimacy, and often improved confidence just from knowing your body is responding again. We've seen pelvic floor training restore erections even in post-surgical patients, in men with mild nerve damage, and especially in those with age-related decline. But here's the secret most men miss. You can't stop at the muscle. You need to activate the system that controls arousal itself. And that brings us to exercise number 2. This one is called parasympathetic breathing with pelvic release. That might sound technical, but the method is simple, and it's crucial. Let me explain why. Erections are controlled by your parasympathetic nervous system, the part responsible for rest, relaxation, and arousal. But most men over 60 spend their day in sympathetic dominance, meaning they're in a low-grade stress state. That stress closes off blood vessels, tenses pelvic muscles, and floods the body with cortisol. You can't be in fight or flight and expect your body to shift into rest and arouse mode at the same time. The fix? You train your nervous system to switch states. And the fastest way to do that is with intentional breathing. Here's what to do. Lie on your back with your knees up and feet flat. Place one hand on your chest and one on your belly. Inhale slowly through your nose for a count of 4. Feel your belly rise, not your chest. Hold for 2 seconds, then exhale through your mouth for a slow count of 6. Feel your belly fall. That's 1 breath. Repeat this for 5 minutes every morning and again before bed. During the exhale, silently say the word release to yourself. Imagine your pelvis softening, blood vessels opening, and tension melting away. This visualization enhances the effect. Over time, this trains your nervous system to calm down faster, to shift into the ideal state for circulation and performance. After 2 weeks of doing this, most men report more spontaneous erections, not triggered by arousal, but just natural blood flow returning. And that's what we want. That's how we know the system is waking up again. Now, there's a bonus to combining this breathing with pelvic floor training. When you coordinate the two, you're engaging both muscular and neurological control over your erections. That's a powerful combination. It's like rebuilding the structure and rewiring the circuit. You can do this. 5 minutes in the morning, 10 reps of pelvic holds, 5 minutes at night. That's less than 20 minutes a day. No equipment, no cost, just commitment. And it works. But we're not stopping here. The third exercise is for men who've lost the fullness, the girth, or the firmness they once had. It's called vascular stretch and squeeze. And it's exactly what it sounds like. You're going to manually stimulate blood flow through the shaft to retrain your body to send blood where it's supposed to go. This is not about stimulation or pleasure. This is about therapy. Start with warming up the area. Use a warm, damp cloth and wrap it around the penis for 2 to 3 minutes. This relaxes the vessels and prepares the tissue. Then, using your thumb and index finger, form a loose ring at the base of the shaft. Very gently, you'll squeeze and pull forward in a slow, steady motion. Imagine you're pushing blood forward from the base to the tip. Do this motion 10 to 15 times, holding each stretch for about 2 seconds. Never cause pain and never overstretch. This is not about forcing change. It's about encouraging blood flow and elasticity. When done properly, this improves circulation, reduces plaque formation, and promotes vascular health. It can even help men who experience cold or numbness in the area. Add this to your evening routine, just 3 to 5 minutes. Always follow with deep breathing. It creates a closing feedback loop for your body. Muscles engaged, blood flowing, nervous system calm. And here's something I'll say to every man over 60. This is not about regaining your 20-year-old performance. This is about restoring your confidence, your connection, and your control. These exercises are tools. You're the one doing the work. You're the one taking action. Now, in the next part, I'm going to introduce a physical therapy technique that most men have never heard of. It's used in clinical recovery protocols, and it helps rebuild penile tissue from the inside out. If you've struggled for years, this might be the method that finally unlocks results. So stay with me. Part 2 is where things get even more exciting. The fourth exercise I'm about to show you might sound unusual at first, but it's one of the most effective tools I've seen for restoring firmness, especially in men who've had declining blood flow for years. It's called penile tissue mobilization with suction therapy. In hospitals, we use it during post-surgical recovery to preserve erectile function. But with the right technique, it can be safely used at home, and the results can be remarkable. Let me be clear. This isn't about using a device to create an instant erection. This is about training the body to remember what it used to do naturally. Blood needs to be brought into the chambers regularly. If it doesn't, tissues lose elasticity, oxygen drops, and nerves stop responding. That's where the suction comes in. It brings in blood, gently expands the vessels, and helps repair what's been dormant. To start, you'll need a medical-grade vacuum device. Not one of those gimmicky toys you see online. You want something consistent and adjustable. Sit comfortably in a private space. Lubricate the rim of the cylinder and the base of the penis. Insert gently and begin to create mild pressure. Never rush. You want to see slow, steady engorgement, not discomfort or pain. As the blood flows in, your penis will start to swell and lift. Once you reach full inflation, hold the suction for 10 to 12 minutes. Breathe deeply while you do it. Focus on relaxation. Do not overstimulate. This is not about achieving climax. It's about training the vessels to expand again, just like stretching a muscle. Do this 3 to 4 times per week.
For men who've had little to no nighttime erections, this reintroduces blood circulation. It keeps the tissue healthy. It builds a foundation for future arousal to happen naturally. And there's something else it does, which most men don't expect. It starts to rebuild confidence. When you see your body respond, even mechanically at first, it reignites something inside. Men report feeling more hopeful, more in tune with their bodies, and more engaged in intimacy, not just physically, but emotionally. I worked with a patient, 74 years old, who hadn't had an erection in 5 years. He had given up. His wife had too. I introduced him to suction therapy. He followed the protocol exactly. After 6 weeks, he came in smiling with tears in his eyes. He said, "I never thought I'd see this part of me come back." And it did, because he committed. And now, before I move into the final technique, I want to address something a lot of men quietly wonder but never ask. They ask, "Am I too far gone?" Let me answer you directly. No, you're not. As long as there's blood flowing in your body and breath in your lungs, your tissue can adapt. Your body is capable of healing at any age. But it requires you to take the first step. It requires action. And the next method might just be the most surprising of all. We call it traction therapy, or in more familiar terms, the penile extender protocol. I know, many men hear that and immediately think it's about size. But that's not what this is about. This is about restoring function, improving blood vessel density, and reversing atrophy. We've used this method for men recovering from prostate surgery, those with Peyronie's disease, and yes, for men with age-related loss of function. The science is simple. Controlled tension over time stimulates angiogenesis. That means the formation of new blood vessels. It encourages collagen remodeling, which improves elasticity. It also helps correct mild curvature and restore symmetry. The key is low force, long duration. Here's how to do it safely. Start with a high-quality extender device with adjustable tension. Fit it comfortably to the flaccid penis. It should create a light pull, not painful, not tight, just enough to feel a gentle stretch. Begin with 30 minutes per day. After the first week, increase to 45 minutes. Eventually work up to 1 to 2 hours daily. Always use in non-erect states. This is not for arousal, it's rehabilitation. Think of it like using resistance bands for a recovering muscle. You're restoring form and function. Some men worry about safety. Let me reassure you, when used properly and gradually, this method is not only safe, it's one of the most effective ways to restore length lost due to disuse, maintain penile tissue health, and improve response to arousal. In fact, clinical studies have shown improvements in spontaneous erections, morning wood, and even sensitivity after consistent use over 3 to 6 months. One patient of mine, 74 years old, said something I'll never forget. He said, "I wasn't trying to impress anyone. I just wanted to feel like myself again." That's the heart of it. These methods aren't about proving something. They're about reclaiming what's already yours. Now, as we bring all these tools together, pelvic muscle training, parasympathetic breathing, manual blood flow stimulation, suction therapy, and traction therapy, you might be wondering, how do I organize this? What's realistic to do daily? What do I rotate? What gives the best results? In the final section, I'm going to lay out a complete weekly plan, simple, practical, and tailored for men over 60. And I'll show you the one small 7-second daily habit that amplifies all 4 techniques. Faster results, stronger responses, and most importantly, a feeling of power and control that no medication can match. So, stick with me.
So let's pull this all together in a real-world plan. Something simple, flexible, and tailored specifically for men over 60. No fluff, no guesswork, just what works. Start with pelvic floor training every morning, 5 days a week. Right after you wake up, before breakfast or coffee, sit on the edge of the bed or a firm chair. Back straight, feet flat. Contract your pelvic muscles like you're trying to stop urine midstream. Hold for 5 seconds, release slowly. Do 10 reps, rest for a minute, then do a second set. As you get stronger, work up to 3 sets per morning. Total time, under 5 minutes.
but the benefits compound fast. In the evening, add parasympathetic breathing. Just 5 to 7 minutes before bed. Lie flat or sit in a recliner. Close your eyes, breathe in through the nose for 4 seconds, hold for 4, breathe out through the mouth for 6. Let your shoulders drop, let your heart rate settle. This tells your nervous system it's safe to repair, it's safe to grow. Sleep gets deeper, testosterone production rises, erectile response improves organically. Now, 3 times per week, say Monday, Wednesday, Friday, use suction therapy. You want to space it out for tissue recovery. Do it in the evening, when you're relaxed and not rushed. Use a medical-grade vacuum device, 10 to 12 minutes per session. No arousal, no distractions. Just calm breathing while blood flows into the chambers and stretches those tissues gently. That stretch is like watering a plant that's been dried too long. It brings life back. Then on alternating days, Tuesday, Thursday, and maybe Saturday, use the traction protocol. Start with 30 minutes, build to an hour over time. Always light tension, always a relaxed environment. Some men do it while watching TV or reading. Make it part of a routine you actually enjoy. That way you stick with it. And on Sunday, that's your rest day. Let the tissue recover. Let the nerves integrate the work you've done. Growth doesn't happen during activity, it happens during recovery. That's when your body rewires, rebuilds, and restores. Now, I promised you a 7-second habit that amplifies everything we've talked about. Ready for it? Here it is. Every time you urinate, finish by doing 1 strong pelvic floor contraction. Just 1. Hold it for 5 to 7 seconds, then release slowly. Why does that matter? Because it builds a direct neurological link between the act of urinating, controlled by your pelvic muscles, and your subconscious control over those same muscles during intimacy. You're reinforcing that connection several times per day with minimal effort, and over weeks, that adds up to better control, stronger contractions during climax, and more consistent blood flow. I've had men tell me that one tiny habit changed everything. I felt more in control just from that. It works because it's tied to your body's natural rhythm. It doesn't feel like a chore. It becomes automatic. Let me also share a bonus that very few people know. Combine all of this with moderate walking, just 20 to 30 minutes a day, and you get an additional testosterone and circulation boost. Walking increases nitric oxide production, lowers insulin resistance, and reduces stress hormones, all critical factors in erectile health. You don't have to run, you don't have to lift weights, just walk, preferably outdoors. Morning sun, if possible. That light hits your retina, tells your brain to regulate hormones, and you sleep better at night. If you're serious about rebuilding function, this trifecta of pelvic activation, nervous system regulation, and mechanical stimulation is the closest thing we have to a complete natural solution. And if I can be honest with you for a moment, I want to say something man to man, heart to heart. You deserve to feel alive again, not just sexually, but emotionally. Intimacy isn't just about function. It's about connection, confidence, pride. And for too many men, that's been quietly slipping away for years, sometimes without them even noticing. But here's the truth. It's not gone, it's not lost, it's just dormant. And with these 4 tools that require no pills, no surgery, no side effects, you can wake it back up. You can restore that sense of vitality. I've seen it happen. I've seen men in their late 70s come in with no hope, only to return months later with a sparkle in their eyes and a thank you note in hand, because they followed the process. They showed up for themselves. And I want that for you too. Now, a few rapid-fire tips to lock in your success. Hydrate like it matters. Your blood is over 90% water. Dehydration means sluggish circulation. Aim for 60 to 80 ounces a day. Cut back on alcohol. Even 1 to 2 drinks can reduce testosterone for 24 hours. You don't have to quit, but moderate. Avoid evening screens. Blue light crushes melatonin, and that lowers nighttime testosterone release. Get off devices at least 60 minutes before bed. Magnesium before sleep. A simple supplement can support relaxation and recovery. Most men are deficient without knowing it. Stretch your hips. Tight hip flexors restrict blood flow to the groin. Gentle yoga or even seated stretches can help massively. You don't need to be perfect. You just need to be consistent. 1 day at a time, 1 habit at a time. Stack them up and momentum builds. Let me leave you with this. At every stage of life, a man has the right to feel whole, strong, and desired. Age doesn't take that away. What takes it away is inaction. What gives it back? Intention, effort, a decision to say, I'm not done yet. So if you've made it this far, I want to thank you. You've already done something most men never do. You've chosen to learn. You've chosen to act. Now take that knowledge and move forward. Start today. Rebuild your foundation. Reclaim your edge. And remember, it's never too late to feel like yourself again. I'm Dr. Sophia Jain, and I'm proud of you for showing up.